Time frozen. Subhashis?
Yes, sir.
Yeah, it's live. I checked in
Why is
Facebook,
my
YouTube.
Your what, sir? सुनाई नहीं दे रहा है. Once again.
Why is my time frozen on my computer?
Time frozen.
Yeah.
I think, sir, आपका video on है क्या? Just to check.
It's on.
Yeah, now it's
on.
okay.
Yeah,
Now
it's okay. Time frozen, I think that is a system thing, might be, sir. But you are good on the screen for us. Both audio and video, both are fine. Yeah.
Pretty good. Anyway, I'll just keep my phone also connected just in case.
Right.
May I open the meeting?
Yeah. Go ahead.
All right, 1 minute. Dr. Punita waiting.
Can someone add Punita, ma'am? Is she added? Is she here?
There's a waiting room participant called Om Masrani. Is it her?
Yeah.
Yeah. Allow her, please.
She's on.
Yeah.
Joy, add. Yeah. She's with us.
The names are sometimes, confusing. Yeah. Right.
Mr. Subhashis, am I audible to you?
Yes, sir. Loud and clear. Good.
Ashish Patankar, is he in the waiting room? Can you just admit him?
Yes.
There's no one with the name Ashish Patel in the waiting room.
Ashish Patankar.
नहीं दिख रहे waiting room में.
Okay.
There's Praful Sharma is also in the waiting room. Please take him in.
Yeah. Praful Sharma, sir, has just came in. Yeah. Punita, ma'am, can you hear us?
Yes, I can hear you. Can you?
Oh, yes. Yeah, ma'am. We can see you as well. Perfect. Good morning.
Good morning. Am I clear?
Yeah.
Okay.
Yeah.
Okay.
Clear.
Have you let him, Praful Sharma?
Yes. Praful sir is in. Yeah.
Good morning to everyone.
Good morning.
Namaskar.
Good morning. Good morning, Prabal ji.
Kala ji, good morning, Madam President Sahiba. Good morning.
Namaste, sir.
Good morning, sir. कैसे हैं?
Very fine. Thank you so much. All good and very interesting topic. Good.
Yes.
Right.
I'm not seeing Amarjit Praji. Amarjit ji हैं?
हाँ है सर इधर ही है. हाँ.
Good. हाँ दिख गया.
I think we'll go live in a minute's time now.
Yeah, exactly. 30 seconds more, you can go live.
Yeah.
I'll open the waiting room now.
Yeah, you can allow everyone in.
Yeah, because I have a lot of Rotarians now.
Right. Yeah. Perfect.
Praful ji, namaste.
Namaskar, sir. Namaskar.
Yes, we can start. Over to you, Kalama.
Right. Let's let in everybody from the waiting room and keep it open.
Yeah, it is open, sir. Yeah.
Thank you so much.
Because now we are entering the public domain.
Yeah.
Morning, Harpreet.
Good morning. How are you?
I'm good. Thank you.
Kala ma'am, if you can unmute yourself, please. Sorry. Perfect.
Yeah, stop the share screen.
Yeah, please. Stop the screen share. Yeah.
Yes, Ashish. Hi, Ashish.
Ashish, good morning.
Good morning.
Yes, we can start.
Yes, ma'am. Go ahead.
Yeah, let's start.
I call the meeting to order. Good morning
Good morning.
and a
Good
warm
morning.
welcome to all the guests. PDG Prafulji, members, district dignitaries, Rotarians, invited guests. Into the 3 months in the vision year, I am very happy to share that our club has completed 25 projects involving 300 volunteers, over 700 hours, impacting nearly 13,400 people. In the vision year, our district 3141 has formed 7 new interact clubs, and we are proud to say that 5 of them are ours. We will be launching our flagship project Udaan in the virtual format very soon. At Rotary Club of Mumbai Juhu, apart from our flagship projects of Sanskar, Udaan and Umang, we take initiatives to spread awareness for greater good of the society. And today's topic falls in the same line. COVID-19 has brought about a lot of changes. Turning the economy upside down, it has made us adopt to the new normal. There are positives like no traffic jams, fewer cars on the roads, saving of time and fuel. Once we learn how to manage this process and achieve some balance between personal contact and efficiency, this is a new normal that will be around for a while. But there are some doubts. Is this going to be the end of the air travel? Will air travel be scaled down? Will we be having social distancing in airplanes? If yes, how? How will the SMS principle be applied? Social distancing, mask, and sanitization. How will this impact the airlines? Will the cost of air travel increase? So many doubts and apprehensions. As they say, an informed passenger determines his new direction. With all these doubts, we decided to have this webinar on how safe is air travel during the pandemic. This webinar aims to address the fear of air travel during the pandemic by particularly focusing on the quality of the air inside the cabin as a major part of the passenger journey takes place inside the cabin aircraft. Before we start today's webinar, our Chief DG Sunnil Mehra could not join today's session due to some urgent meeting which he had to attend, and we are really thankful to PDG Praful Sharma, who has agreed to grace today's occasions as chief guest.
Pleasure.
About PDG Prafulji, he is an avid nature lover, born and brought up in Mumbai. His family originates from Rajasthan. His schooling from Poda School, Santa Cruz, and he has studied at the KJ Somaiya College, Ghatkopar. After studying printing and technology from Government Institute of Printing Technology and Photography at JJ School of Applied Arts, Mumbai, he has specialized in advanced printing at Germany. He has worked with Thomson Press Faridabad for 5 years and with Nai Dunya Printery Indore for 2 years. Since 1993, he is a partner at Offset Printing Unit, Scanna Graphics in Mumbai. He also runs a content agency, Content Creators, with his wife. PDG Prafulji is a Paul Harris Society member and a major donor. Joined the Rotary in 1992 at Rotary Club of Indore Central. Later on shifting to Mumbai, was a member of the Rotary Club of Mumbai Ghatkopar, and then from 1995, a member of the Rotary Club of Borivali. During his tenure as president of Rotary Club of Borivali in the year 2021, he began the much acclaimed mega project of plastic-free Sanjay Gandhi National Park. The Inner Wheel Club of Borivali was formed and chartered the same year, and so was the Rotary Club of Borivali Charitable Trust, which also became very active the same year. The foundation of two new Rotary clubs, Rotary Club of Bombay Kandivali and Rotary Club of Bombay Mumbai Borivali East, were two laid on the same year. He is a recipient of Rotary International's 4 Avenues of Service Award. In 2009, he was the District 3140's GSC team leader to RI District 1940 in Berlin, Germany. A Hindi lover, Prafulji has translated the script Astronomy of the Millennium in Hindi for Nehru Planetarium. He is a voracious reader with a keen interest in traveling, trekking, cycling, and performing arts. As a district governor in 2017-18, he has initiated the idea of no-frills, time-bound, crisp district events. District 3141 in that year ranked number 1 in all the zones in India and number 2 in the entire Rotary world in TRF giving. The district received 8 national rewards in the Zonal Institute held in Chennai in October 2018. Prafulji is a district trainer of 3141 for the year 1920. May I now request Prafulji to bless the webinar with his insights.
Thank you, President
Thank
Kala.
you.
Thank you so much. Good morning and namaskar to everyone. Greetings from District Governor Sunnil Mehra and from all the Rotarians to the panelists and non-Rotarians who are joined here as moderators. What an interesting topic it is. Of course, the luminaries are sitting here from the aviation industry. What can I say about aviation? But of course, on behalf of Rotarians and District Governor Sunnil Mehra, I must say something about my own experience with the civil aviation industry as a passenger, as well as the person who imported few machines for my factory for the, of course, for the cargo aviation also. In about 3.5 decades ago, when I first time after finishing my college, I flew to central part of Europe. I took Air India, which I of course still take. I still fly Air India, because the only reason was that because those days Air India was comfortable in serving the veg food, being a vegetarian, and my बाबूजी and माँ thought that अगर दूसरी एयरलाइन में जाएगा तो बेटा मांस और मदिरा खाएगा तो बिगड़ जाएगा. बाबूजी और माँ को पता नहीं था कि बेटा तो तभी मदिरा पान करता था तब जाने के पहले भी. And anyways, those days food was a criteria. Then the wine became the criteria, the drinks, when the more passengers started flying. Then of course the kind of language became the criteria, that the airlines started attracting the passengers with the ad that our crew speak Punjabi or Hindi or Gujarati or Tamil and Telugu. Then came of course, the frequency of the particular airlines to particular destinations. So if one flight gets cancelled, you can definitely adjust it to other airlines on your return flight. Then came the punctuality. So-and-so airlines started focusing and advertising that this airline is a 98.so-and-so% punctual, this airline so-and-so punctual, the staff is friendly. And then, of course, came the safety, which is, of course, the now biggest parameter and biggest plus point for any airline or civil aviation. It happened because of the natural calamities many times when the plane, unfortunately, plane crash, or of course, because of the man-made calamities like hijacking and all. We better don't go to all those parts, but of course, the safety and security is the most important. It became more crucial, more important post-March 2020. We all know that at least for a few weeks after March 2020, entire world ठप पड़ गया था, पूरी तौर पे ठप पड़ गया था, except America and some North American countries and part of Europe. All civil airlines they were grounded. We have been reading about it that so many airlines lay off the jobs, unfortunately. मगर airline civil aviation एक important, बहुत important industry है. उसके बिना हम कहीं आ जा नहीं सकते हैं. हम कुछ सामान नहीं ले आ जा सकते हैं. हमारा घूमना, लिखना, पढ़ना सब कुछ बंद हो सकता है. बहुत important industry है, and I'm very happy that and such an important topic, especially safety and security at the time of pandemic. This topic, the webinar has been organized by Rotary Club of Mumbai Juhu and other 23 or 24 clubs. I congratulate President Kala and all the organizing team. I can understand. I feel that Amarjit Praji also must be instrumental. I know Amarjit ji for the last 2 decades, and for us, for me at least, he is the face of Air India, which I love the airline right from the beginning. As I flew first time Air India, first time I entered into flight, and I wish all the participants very best. At the end of the seminar and webinar, I'm sure people will get to know what safety precautions to be taken during this pandemic time, because the question mark still is there in everyone's mind. कब कहाँ और कैसे हम लोग उड़ पाएंगे वापस, जो उड़ रहे हैं, जो जा रहे हैं और जो वापस आ रहे हैं मुंबई या मुंबई से बाहर या देश से बाहर, वो मजबूरी में जा रहे हैं. अपने तरफ से वॉलंटरली कोई बाहर नहीं जा रहा है कि कोई घूमने जा रहा है या कोई अपने बच्चों से मिलने जा रहा है या कोई शादी विवाह में जा रहा है, नहीं जा रहा है. आई थिंक वो समय कब शुरू होगा पता नहीं, और उसके पहले हमें सेफ्टी प्रिकॉशंस के लिए वेबिनार बहुत लोगों की सहायता कर पाएगा. आई विश ऑल द पैनलिस्ट, ऑल द पार्टिसिपेंट्स, ऑल द मॉडरेटर्स वेरी बेस्ट, और मेरी शुभकामनाएं आपको कि कार्यक्रम के अंत में आप बहुत सारी जानकारी लेकर जाएंगे. Once again, on behalf of District Governor Sunnil Mehra, greetings to all and very best and lovely weekend. Thank you. Namaskar.
Thank you very much, Prafulji. May I now request Rotarian Manmohan Chawla, our Director International Service, who is the moderator for today's session, to take the session forward. Before that, I would like to thank all our co-hosts for today's webinar. Thank you.
Thank you, Kala. Thank you. Good morning, everybody. This is Manmohan Chawla, and I'll be the moderator for this program. And my co-moderator is Subhashis Modak, who is also the director of learning for Udaan Aviation Academy. Subhashis Modak is a dynamic person who's graduated from Bombay Flying Club long back, a very senior person now. And after completing his MBA, he is now a prospective PhD candidate with the Cranfield University in UK on the topic of aviation and environment. Now going ahead with our speakers, I would request our first speaker to come on. Our first speaker is Harpreet Singh. She is the chairperson of Aeronautical Society of India, Mumbai branch, and president of Indian Women Pilots Association. She is the executive director and chief of flight safety and additional charge as corporate QMS, SMS, ERP, EMS, DMS, and CSR at Air India Limited. Amongst her other achievements, she was the first lady pilot selected in Air India in 1988, and as the first lady chief of flight safety in India approved by DGCA. Amongst the other firsts, she is in the following categories in India: human factors and CRM facilitator, head of emergency response system in an airline in India and handled the unfortunate Mangalore crash. First head in India in aviation in various areas such as quality management systems, safety management systems, environment management systems. First head in India in aviation in emergency response systems and for lead auditor and risk management in India. In addition to the above, she also holds the following credentials. She was involved in the training department for many years in a management role besides being a DGC approved instructor. She is in the Council of Tata IOSA Oversight Council, in the COPA lead auditor for conducting ISAGO audits representing IATA. She is the head of the Environment Program and Green Initiative, Fuel Management and Operational Efficiency Program. She has got a number of awards to her credit, starting from 1999 to 2020, this year. Amongst them are the Outstanding Young Persons by International JCs, Limca Book of Records in 2003 as the first woman instructor for pilots of Air India, Swarna Jayanti Award for Aeronautical Society of India in 2007, IWPA Award in 2013, 14, 16, 17, and 18 as an Outstanding Women Professional, Women's Leadership Award in February 2016 by World Quality Congress Global Award, and Women's Leadership Award by the Strait Times on 6 February 2020. Ladies and gentlemen, presenting to you Harpreet Singh. Ma'am, request you for your remarks.
Good morning, everyone, and I hope you can see me clearly.
Yes.
Okay, so good morning, and firstly, a big thank you to the Rotary Club of India as well as the Udaan Aviation Academy. Thank you, Mr. Chawla, for inviting me here, Ms. Kala and Mr. Praful Sharma from Rotary. It's a pleasure to be here, and thank you for the kind words and the nice introduction. Let me get down to the subject directly now. The Aeronautical Society of India, as well as the IWPA, which is our Indian women professionals, Indian women pilots in India as well as abroad, all of us are definitely together in this goal of a safe aviation environment. But right now, I will wear the hat of the Air India Chief of Flight Safety, since we have actually been directly involved with various activities pertaining to the COVID. So I thought I would share some of the challenges which we face and what kind of actions did we take as an airline, as an aviation industry to make sure that the traveler is safe. Because the subject is how safe is air travel. Now, obviously, the people who travel by air are the ones who really need to understand what is the back office work and what is the frontline work that has been carried out in the past, and it continues to be carried out in the present, with a lot of plans for future improvements as well to make sure that it becomes safer and safer for the public. So now let me just begin go back a bit. When we initially began with our operations for COVID kind of CSR activities, which was more like evacuation flights, okay? So we were the first carrier at that point who were told to arrange those flights into China. This is right in the January and February phase we are talking, where there was no lockdown still. So you can imagine the concern that I had to face and the responsibility that we as a team had to ensure, because we were doing this for the very first time. And we had to launch these aircraft into China, where it was all over the world that, in China, there's a total pandemic and this and that. So what we did was we did a lot of study of our own. And I heard the Rotary chair using the word SMS for, I wrote it down, for the sanitization, mask, and the social distancing. So we in the airline have something, the same terminology, SMS, but we call it the safety management system. Now, whenever you talk about risk, life is never with zero risk. Even if I cross the road, I do not know if I'm going to be hit by a car, okay? So you don't stop doing things only because there will be some risk, because there will always be risk. Even when you get married, it's a risk. When you go to work, it's a risk. So I think in the larger context, we have to get out of this so much of fear mode. I understand you have to take care. We understand that we have to be cautious, and we have to apply formal, systematic approach to do a thorough risk analysis, to mitigate the risk, bring down the risk to as low as reasonably practicable, so that your operations can continue, passengers can travel to and fro, as well as at that point of time, evacuation. We had to bring home a lot of Indians. We had to also do a lot of humanitarian response flights, which were primarily for the purpose of carrying medical aid, bringing it to the country, exporting, importing. And we had to do a lot of change management, risk management exercises for our cargo flights. Most of our flights initially were just pure cargo. But keeping that subject aside and focusing more on the passengers, so I would like to just highlight when we have an unsafe environment like COVID, definitely it's unsafe. It is adding to the risk. But in the safety department, what we do is we channelize all the risk hazards, what we call them, safe, unsafe acts, unsafe procedures, unsafe risks, and we try to mitigate it through a formal process called a safety risk management exercise. In that exercise, we not only document all the hazards, we look at all the consequences linked to every hazard. Then we segregate it in between probability and severity. And then we look at how do we mitigate this risk. So to cut a long story short, after a lot of risk mitigation in every action item, we had a plan of action in place. Now, let's begin with just the flights operating from A to B. Firstly, who is operating these flights? They have to be safe. If they are not safe, they themselves can spread the COVID-19 to the passengers, right? So firstly, at the airports, as you may have noticed, and a lot of this has had the support as well as directions of the Ministry of Civil Aviation, Ministry of Health, Ministry of Home Affairs, the regulatory body, the DGCA, everyone had a big role to play in this. But finally, it's the airline that has to really implement it. And we always go beyond what the regulator is demanding or what the ministry is demanding, because you want your passengers to be safe. So coming back to the point which I was saying, for the passenger to be safe, the people in the aircraft itself, the work around the aircraft, and the pilots, the engineers, the cabin crew, they all also have to be safe and not transmit those kind of COVID conditions. So first thing that we do is, at the airport, which I'll just speak very briefly because I was told the focus is more on the aircraft. At the airport, you may have traveled, some of you already. There are a lot of stringent guidelines on social distancing. And as an airline, what we did was that we reduced the number of people at the counters. We put boards that would keep that distance of more than 6 feet away so that there's no counter-to-counter conversation. We encouraged people to do web check-ins. And even when people come at the counter, they're told, please go and do a web check-in instead, so that there is as less interaction close to each other as far as possible. We have a terminology in SMS which we call LRT, which is as low as reasonably practicable. So with that kind of a process, we introduced those procedures. Now comes to when the passengers are going on board, of course, they are given certain what we call PPE, personal protective equipment. So they do have masks, they do get gloves, they do get the face sheet, to cover their face so that there is no contact with the passengers next to each other. But keeping the passenger part on one side, they are also reporting the government requirements of the online reporting forms. So there's a self-declared, mechanism where if somebody is at risk or somebody is asymptomatic or symptomatic, and by that report, there are medical doctors of the airport also and of the airline also who support this kind of a decision-making on whether this passenger can travel or not. A lot of information is already on the website that with such conditions, you should not be traveling. Then, of course, the government requirement of having that app, the Aerobiz Setu app. So that's also mandatory. Now, coming more to the specific airline requirements. Now, we are one of the only airlines, I would say, that does a COVID test for every pilot and for every cabin crew that does an international operation. We have the Government of India humanitarian response flights called Vande Bharat flights. Now, when you do the COVID test, what happens is within the next 2-3 days, you get the result. Unless the test result says that you're negative, you're not rostered for that flight. If your test comes as if your test comes as positive, then you're removed from the roster. So that is first one level safety check. Now, as you move in the safety risk environment, you keep continuously monitoring and you keep checking the results of what you're doing. And you can also increase your safeguards or reduce them depending on what the results are showing. So now in this particular case, initially when we started, every pilot and every cabin crew was doing 3 tests. One is pre-flight, one is immediately after the flight, and one is 5 days after the flight. So if they were doing the test 3 times for every flight, and which itself was having some kind of additional risk, residual risk, what we call linked to it. They were exposing themselves continuously to crowded locations where the COVID testing is happening. We got a lot of what we call voluntary reports saying that, do we really need this to happen so many times? Over a period of time, we analyzed the results and we said, okay, fine. We will continue only for the pre-flight. And post-flight, we will do it on a voluntary basis. If you feel you're getting some symptoms or you don't feel comfortable without doing it, we've left it to the choice of the cabin crew and the pilots and the people who are doing official duty that you can ask for the test. So we have changed it slightly in the recent past. From the last 1.5 months, we are not having for every post-flight. We are doing it mandatorily for pre-flight, but post-flight, it is on the choice of the cabin crew and the pilot. So the passengers are automatically protected because the crew are protected. The cabin crew, you may have seen them on the flight. You may have even seen the pictures. Besides the standard items of sanitizer, mask, etc., we make them wear hazmat suits. So they're actually fully covered in hazmat suits. There are shoe covers as well. And there is proper social distancing procedures maintained, that they have been taught that even when the passengers board the aircraft, what kind of distance is to be maintained and what kind of procedures are to be followed. Now, from the passengers' perspective, initially they did go through a lot of discomfort because no meals on board, because that was our risk mitigation. Initially, we did not want to take any risk at all. We said no meals on board, no hot service, no beverage service. Whatever you would like to eat, you have to do it prior to boarding the aircraft, because on the flight, you would just be taken from A to B and maximum given a boxed, boxed catering box, which would have certain minimum items, which you can have for yourself. Now, as we moved along and we kept doing the analysis, we realized that we could increase the quantity of the boxed items, which we have done in the recent past. We have also started some beverage service in the recent past, but we are still not doing pouring drink service. At this point, it is in the interest of the passengers. We still feel there is a lot of risk in those kind of procedures to be introduced. So we have still not done that. But we keep evaluating as we move on. There is a request now that the in-flight entertainment, which especially on long flights, the passengers would like to see these months, we did not allow the IFE to be used because of additional risk that we could see in the contamination of the screens and the spread of, touch screen, and then your hands are going all over the place, etc., etc. But we are reviewing the IFE procedures now, but we have not yet commenced it. Now comes if a passenger is seated on his seat, he is supposed to wear a face shield. He's supposed to wear his mask along with the face shield, and he's supposed to wear his gloves, right? And there was a lot of discussion initially. We used to keep the middle seat vacant, which we still do in case the load is less. But if the load is more, we did our safety risk mitigation. We consulted the medical departments. We consulted the ministry and everyone together. And it was agreed you can allow them to sit in the middle seat, because there was a larger risk of the country overall that you have to bring home all these Indians. And if you just have the aircraft flying empty, half empty, how are you going to, get everyone back? So now with the middle seat, we have added some safety initiatives there, that yes, you will not only get your face shield, you will get your mask and gloves, of course, but you also get a PPE gown to wear. So how do you mitigate? You mitigate by putting additional safety, aspects into consideration and introduce them. So they also get a gown. So, and the timing of the eating is done in such a way, the cabin crew are trained for that when they serve them the meals, they tell them, okay, you two can eat first, then you can eat, then the next one can eat, so that everybody doesn't lift up the face shield at the same time. So these kind of announcements are continuously going on board to keep the passenger fully protected. Now, what happens if the passenger wants to go to the washroom? So we have some procedures in place for that. So if the passenger wants to go to the washroom, he has to ring the bell, and we have to make sure that there's no crowd there. There is social distancing. It is one at a time only. And we also have certain disinfectant sprays. Every time 5 passengers have used the washroom, the cabin crew have got special disinfectant sprays, which they have to clean the washrooms accordingly and make sure that the environment is safe for the passengers. Okay, this is the other part. Then comes the engineering side, the deep cleaning. I know there's some, Mr. Deshmukh probably will give details, so I will not go into too much detail into that. But just broadly, we do have deep cleaning of the aircraft, cockpit cleaning, seat cleaning, which is done in a very deep manner. But we also have the transit cleaning checklist, and which is for the quick turnarounds. So at both levels, the checklists are being followed. We monitor it very closely. We make sure that the passengers, where they are seated, that entire area is safe. There was a lot of doubt created on the, whether the air that the passengers are breathing is that healthy or not, and this and that. But to be honest, the aircraft design itself has those HEPA filters, and the recirculation happens in such a way that you always get clean air to breathe. And I'm sure my colleagues who are on the panel will give you more details on that. So this is the broad picture which I would like to share with you. And I would also like to tell you now, one is the PPE you wear yourself, you protect yourself. You have to also follow some discipline yourself. As a passenger who's traveling, the airline can do everything to make the environment safe for you. But we also have certain passengers who would argue, who would not agree to wear the mask. On board, they will create a scene, they will remove the face shield. So we do have a lot of challenges. Here, when we say, is it safe? Firstly, you make yourself safe, because you very well know what the requirements are. It's all on television. It is all on those WhatsApp messages, on the app of the government. Everybody knows the requirements. So you also need to follow the rules, have some discipline. And then the airline is also following its own disciplined processes, and then we will remain safe. The other thing I would like to speak is from an emotional and mental and spiritual level. What happens is you cannot live in fear. Being cautious is one thing. Doing risk mitigation and taking precautions is one thing, but you cannot live a life of fear. If you keep fearing that you will, ye ho jayega, wo ho jayega, kal ko aapko baithe baithe bhi kuch ho sakta hai. You will collapse from the bed, So you have to strengthen yourself. So I feel this COVID environment, when you say, is it safe to go? You firstly make yourself safe. You make yourself powerful. You make yourself strong in your mind. This is the way the world is today. So how am I going to deal with it? Am I going to hide in my house for the rest of my life? I'm not going to. I have been going to office every day without fail. Yes, but taking precautions despite the lockdown, because we were doing the emergency procedures. But what I'm trying to say is that even for the normal public, as you can see, it is gradually opening up. COVID, whether it goes away or doesn't go away, our doctors will share the medical aspects of that. But fact is, as individuals, you know what care you can take. You need to just do that. And you need to be strong from inside. You need to be positive that this will also pass. And you need to just enhance your guards and just have a little better, processes in place to guard yourself. That's all. And I don't think anything more is required. I can foresee, yes, the challenge, air travel will be reduced. That is not because only of COVID. That is because we have learned that today the technology has moved. This conference, we are doing a beautiful webinar only because COVID has forced us into such kind of environments that you can just connect with everybody around the world. So yes, we do see a drop in business travel, definitely. But families meeting each other, sightseeing, other things, I don't think it'll totally go away. So with that, I would like to end and not take too much of your time. And I really thank you once again for giving me this platform. And, I hope I gave you some aspects of the safety. And we are continuously monitoring, by the way. Every flight we are monitoring, we get reports, we're looking at feedback, and we're always ready to change and continuously improve. Thank you very much.
Thank you, Harpreet, for the tremendous insight and the knowledge you've given us about the safety of air travel. Ladies and gentlemen, I've just seen that Mr. Sunnil Mehra, our DG, has joined. And therefore request our DG Sunnil Mehra to kindly say a few words. Audio, sir. Just unmute your audio. Yeah.
Thank you so much, President Kala. This is I'm actually at some meeting in Kala. I cannot refuse you for whatever reason. All about aviation. Travel and travel planning are being kind of disrupted by the worldwide spread, of course, of the virus. I think for those holding onto hopes of a roaring surge in travel demand, once we are told no longer to have the fear, like you were speaking, or guard against the virus, the data are beginning to stack up against you all and against the endangered airline, hotel, and related travel industries. Very few adults say they would be traveling abroad a commercial airline on the first day after officials sound the all clear and remove all restrictions or health warnings. Put in place that the limit the limit of the spread of the virus and the resulting epidemic has really caused a lot of fear psychosis. And the worrying part for that, for your typical industry, is that very few, and I think very, very few, say that they'll be comfortable even flying after 60 days of you declaring it safe. The worrisome part is how many will be comfortable even flying next 6 months later, even assuming the restrictions on health, warnings are all clear and have been taken care of. Such a recovery is neither full enough or quick enough to stop the massive amounts of bleeding you all are going through. And the airlines and the aviation industry are probably one of the nation's biggest business sector. Even assuming roughly about, let's say, 60% will be willing to fly commercially 6 months after the all clear signal is given, that does not mean all airlines will be flying with 60% of their seats filled. Far from it. In normal times, when virtually all adults presumably are willing to fly, only about half of them actually take even one flight per year. All sectors are reeling, but it is the tourism and hospitality industry that has really been hit the most, given the border closures, travel restrictions, and lockdowns. The other concern is, and this is a rumor, the other concern is, will airlines cut costs, and thus even on maintenance costs? This is what rumors are really floating around. I'm sure that's different. So I think the airline industry does not have to address just the issue of fuel charges and the capacity filling, but actually how to address the fear of travelers and satisfy that it's safe to fly. Thank you.
Thank you, sir. Thank you so much. And thank you for making a comeback to the program. We look forward to it. Ladies and gentlemen, we now go on to the first technical speaker of our day. He is Mr. Deshmukh, a doyen in the industry and who has an experience of more than 45 years in the aviation sector. He joined Air India in 1971 as the graduate engineer trainee, and he retired in 2006 as GM, General Manager, Quality. In Air India, he handled various assignments in maintenance, quality, safety, and infrastructure development. After leaving Air India, he was with the Boeing India MRO, that's the maintenance, repair, and overhaul facility, and other companies mostly out of India. He, along with other colleagues, set up a consultancy company named Aerobiz International in 2007. Aerobiz provides consultancy in aviation infrastructure and other areas. Now, as Director Aerobiz, he looks after aircraft and infrastructure consultancy. May I also add here that he is a fully accomplished and qualified engineer on all Boeing aircrafts in India and the initial Airbus aircrafts which came into India. Presenting to you, Mr. Deshmukh.
Good morning, everyone. The way of life as we knew it has simply disappeared. We've all got a glimpse of prison life at home. Thankfully, that phase seems to be over. The doors have been opened and we have been venturing out a bit at a time. Today, our subject is air travel. I'm going to talk about aircraft cabin air and what safeguards are built in the system. The urge to zoom out and see the wide world is tempting. Perhaps to see someone close, or conclude a business deal, or just let go and travel. Whatever be the reasons, the question is asked, is it worth the risk? Will it be safe traveling in a crowded cabin? It's always good to take an informed decision, understand the risks and be aware. Let's look at options for travel. Travel by road with family is always a good option for short distances. Train travel is good for long distances, but the exposure time is long, probably in days. Flights are fast and save time, and so the exposure is less, and there's already technology in place to keep you safe. At times, you have no choice but to travel by air, like an international destination. Then again, to take a flight, you might have to take a train or a taxi, and finally walk through the endless airport. Today, we'll look at the source of cabin air, the system that handles it, the air distribution in the cabin, and the cabin ventilation. Let me assure you, we are not going to talk about the details of the technology. We'll only give you some simple facts which will help you make an informed decision about air travel and why the air in the aircraft will not make you or anyone else sick. It is generally accepted that enclosed air-conditioned spaces are to be avoided. The best option is to be out in the open with fresh air flowing around. This avoids cross-contamination. Cinema theaters are still closed for this reason. Open air has fewer risks and none if you take adequate personal precautions. Aircraft cabins apparently look like confined air-conditioned spaces in which you spend long hours. But the World Health Organization and others have declared flying as safe with normal precautions. So why would flying in an aircraft be safe? Let us go step by step and see what the reality is. These are the three phases of aircraft flight: takeoff, cruise, and landing. The longest time for most flights is spent in the cruise phase. The cruising phase is normally at about 30 to 36,000 feet. Flying high above the clouds ensures a fast and smooth flight with efficient fuel consumption. At this altitude, the air has less oxygen and the temperature outside the aircraft is minus 50 degrees centigrade. To survive at this altitude, we need the help of technology. Let us see what keeps the aircraft passengers safe at this altitude. The aircraft cabin is like a balloon, though it doesn't look like this. As the aircraft climbs to a higher altitude, it has to be pressurized to maintain the oxygen level at what we are used to breathing. When the aircraft is flying at 34,000 feet, the cabin is like Darjeeling at 6,000 feet to maintain the oxygen level. The outside air is very cold at minus 50 degrees centigrade. Once the aircraft climbs to a high altitude where it is cold outside, the cabin air needs to be warmed up to maintain 25 degrees centigrade. It is necessary to remove the harmful carbon dioxide from the air and maintain the oxygen level. Since it is very cold outside, the cabin will cool down fast if more heat is not added. The cabin air is continuously thrown out. This is done by valves which push the air out. As air rushes out of the aircraft to the outside atmosphere, it allows fresh air to come in. With this system, all of the aircraft air gets replaced every 2 to 3 minutes to maintain the cabin temperature, pressure, and oxygen level. So unlike other air-conditioned rooms, the aircraft air is always fresh. Let us see where this air is coming from. The air for the cabin is coming from the aircraft engines. The cabin supply air needs to be hot and at a sufficient pressure. This is one of the most commonly seen turbofan engines, the CFM56. Normally on the aircraft it's all covered and streamlined by panels, so you will never see it like this. The front of the engine is a powerful fan. The fan is the one providing most of the thrust to propel the aircraft. The main fan stage is followed by a series of smaller fans which act as air compressors. Part of that compressed air is bled out as cabin air and the rest is used to burn the fuel to propel the aircraft. This compressed air is clean, very hot, and at a high pressure. At that temperature, nothing can survive. This is a simple diagram of how the air moves through the aircraft. The hot air from the engine in orange flows through heat exchangers. These heat exchangers cool the hot air from the engines to a bearable lower temperature. The warm air then goes to a mixing chamber from where air shown in blue finally goes to the cabin. In addition to the air, some part of the cabin air needs to be recirculated. Air that is recirculated has to pass through a filtration process called HEPA filters. Recirculation of air is required to make sure that there are no uneven zones which are either too cold or too hot. Also, there are air vents above each seat for personal comfort. It is also necessary to conserve heat. Recirculation helps do that. there is a possibility that recirculating air might carry particles, bacteria, and viruses. There is a need to eliminate that possibility. Here, the hospital technology of filtration comes to our aid. Hospital buildings have recirculation of conditioned air similar to any other building. But in a hospital, air may have bacteria and viruses. Hospital air is scrubbed through what is called HEPA, or high efficiency particulate air filters. It is a proven technology and is highly effective against bacteria and viruses. It is not new and has been in use for a long time. The same filters are used in aircraft for recirculating the air, so even the recirculated air poses no threat. This mix of air is introduced in the cabin in a very controlled manner. The airflow pattern inside the cabin has been specifically designed in a way that there is no direct blast of air. A blast of air can be a little uncomfortable. Pressurized air enters from the top and is forced down. As it comes down, it is sucked out from the floor of the cabin. There are outflow valves at the bottom of the aircraft. These valves are open to outside atmosphere, which is almost a vacuum at 34,000 feet. Here you can see riser ducts bringing in fresh air inside the cabin, and they are fitted all along the length of the cabin. This creates a wash of fresh air at the shoulder height, which is going towards the floor. In effect, every seat is in an envelope of swift flowing fresh air going down to the floor. And this is for the entire cabin. Observing normal precautions like mask and not touching the face will keep you as safe as being out in the open. We've seen that as long as you're seated, the airflow around keeps it safe. There is only one other place a visit may be required, and that is to the lavatory. Airflow pattern in the lavatories is similar to the cabin, from the ceiling to the floor. Air coming out of lavatories is not allowed to mix with the cabin air. It is directly sucked out of the aircraft. The galleys in the aircraft are similarly vented out. Galley lavatory vent system is a separate system. Galley and lavatory air is kept clean by this system. While in the lavatory, taps and surfaces may have been touched. Sanitizing and washing off before and after use will be a good practice. It is advisable to carry your own wet wipes and be safe. Airlines themselves are taking great precautions to keep aircraft clean and sanitized. There are instructions for observing personal safety measures during the flight. If we all observe them, flights are definitely safe. So if you have to travel, consider flying as a safe option and observe precautions. If there are any questions, we may have some time at the end of the program. Thank you for listening and happy flying.
Thank you, Mr. Deshmukh, for those valuable insights. Now, it's a great pleasure for me to introduce our third speaker for the day, Colonel Dr. K. Nageshwar Rao. Dr. Nageshwar is an aviation medical examiner from India. He is a clinical and aerospace physician and a senior medical administrator with extensive experience in leading independent medical units of the Indian Armed Forces. After his rewarding career in building and developing successful practices across various medical echelons in the Indian Armed Forces till 2016, he now has moved on to the civil stream of aviation and is currently the medical director at the largest airline in India, Indigo Airlines. His areas of interest include fatigue management and prevention of disease spread in flight. He has multiple scientific papers published in peer-reviewed journals. To add to this, he has also been a guest speaker on multiple occasions on national and international forums related to aerospace medicine. Today, we all feel honored to hear straight from the person who has been actively setting up pandemic-related policies in consultation with bodies like DGCA and the Ministry of Civil Aviation. I'm sure that you all have got a lot to ask him, which we all will be doing towards the end of this session. I hope the oncoming presentation covers a good chunk of your queries. I request Colonel Dr. K. Nageshwar Rao to begin with his insights. Thank you. Over to you, Dr. Nageshwar. You can start screen share. Thank you.
A very good morning to everyone. I hope I am audible.
Yes, sir.
Okay. Let me begin by saying that is COVID a disease worth the kind of attention it is getting? Or is it a disease created by an information epidemic? As a doctor, I am slowly swerving to the latter. By that, I don't mean that it is by any means less dangerous, but it is a disease which should not have put so much fear in our minds as it has. The more we discuss it, the more the disease dangers seem to be increasing. Yes, we do not have a vaccine at this time. Yes, we do not have any treatment at this time. But when you see the pattern of diseases evolving in this country, it's not as dangerous as it is being portrayed to be. Disclaimer, these views are personal. Captain Harpreet and Mr. Deshmukh have actually eased my job because they have already introduced most of the things that I'll cover. And I'll definitely be coordinating it from the medical viewpoint. So in case you do have questions, please do keep them for the end. The moment my presentation is over, I'll take all of them. All of you are aware that the airline industry has taken a huge beating, but we are quite positive. We are quite positive that this fear, which will be addressed by Dr. Punita after me, would be taken care of, and it will ensure that we grow back to our previous levels. Will that happen overnight? No, it will not. Will that happen in a few months? Maybe not. But in the next couple of years' time, definitely. The question, let's go question by question. Is it safe to travel at this point of time? COVID may or may not be dangerous, but is extremely contagious. That is beyond doubt. First question you need to ask yourself is, do you need to travel? If you need to travel and the necessity of travel has been determined, can you travel from origin to destination without stopping en route in your own car? If that be the case, the personal car, a personal caravan, personal recreational vehicle that you may have is the ideal mode of transport. But if you have to stop many places en route, the next best happens to be flights. Why and how, I'll go slide by slide. It is definitely more monitored than the buses, and definitely much more monitored than the trains. As Mr. Deshmukh brought out, the exposure levels keep increasing by bus or by train. So the minimum exposure level that you can expect is in aviation. People keep asking why the aviation. Now, aviation is an extremely controlled environment. The first set of controls we get is from the International Civil Aviation Organization, International Air Travel Authority. We can't deviate from them. Then we have the Ministry of Health, the World Health Organization, the Ministry of Home, Ministry of Civil Aviation, and finally, the Director General Civil Aviation, who lay down the checks and balances that every airline has to follow. The COVID has brought together these agencies like never before. Even airlines, when I speak about, I may be a CMO of Indigo, but when I speak about certain things in this, it actually refers to every airline that India has got, and maybe most of the world airlines, because we have been interacting very frequently. One of the questions was raised by Mr. DG, whether safe operations versus commercial concerns. Sir, I would like to clarify this comment at this point of time, that safety takes priority. No airline can afford to have one mishap and thereby lose all its passengers in the long term. And why is airline always in the limelight? Because it's a media grabbing thing, because it connects people like no other industry can. I mean, you have allowed people in the pubs, in the bars, in the hotels, in the restaurants. Then why is airline being singled out not to fly at all? It's not understood. But because it catches the media eye, because a small mistake by any staff in the airline, starting from the pilot to the loader, it comes in the media, it gets magnified that much more. I would like to just run you through a small video that is representative of almost all airlines that we are doing. for the safety of the passengers and of its own employees, each airline is leaving no stone unturned in this time. Whether it is the sanitization of the aircraft cabin, at every landing, believe me when I say this, at every landing, each aircraft is disinfected with approved disinfectant, mainly containing isopropyl alcohol, and each of the person who's disinfecting is also wearing the appropriate PPE. PPEs have been defined for every single trade, every single individual, whether it is bathroom, whether it is the overhead cabin, whether it is the seats, whether it is the frequently touched points within the aircraft. We ensure that we are trying to maintain the highest standards of hygiene. Airlines are very, very diverse. They are spread out. Everything on board now is a biomedical waste. So they are handled as such. As I said, the agents that we are using are approved by the manufacturers. They are based on isopropyl alcohol, and that is what kills the germs in the fastest way. The airport authorities also have come into picture, and the check-in process, we are trying to ensure that there is safe distance being maintained. There is an absolute contactless journey right from the time you enter the airport to the time you board the aircraft. Couple of challenges that we are facing which are not in the airline's control. And I would request every one of you sitting here who would be our travelers to ensure that the place where crowding occurs is the aero bridge, and the moment the aircraft comes to a stop. We don't know why everybody wants to just get up and rush out of the aircraft. When I finish my presentation, you will realize the aircraft cabin is more safer than your car going home. Sit down, let people deboard step by step so that your exposure to the virus is minimized. We also ensure that the coaches that are being used, they are also sanitized. Now, it's a combined effort by the airports authorities, by the airlines, by the integrated district surveillance program, and the different state governments. I'll go step by step as to what a passenger will expect once he leaves his home and what he should be doing. Now, first thing is, when you're traveling to the airport, what all must you do? Check the current regulations of the Ministry of Civil Aviation and the Directorate General of Civil Aviation from the place you're boarding and the place you're traveling to. What is the quarantine requirement? What is the testing requirement? Once you have done that, you have no symptoms. Believe me, if you have symptoms, you will not be allowed to travel. If you have a temperature of about 100.4, you will not be allowed to travel. Your Arogya Setu app has to be green. If you don't have an Arogya Setu app, you will be asked to fill up a health declaration at the airport. Ensure that you are packed correctly. You have sanitizers carried. 100 ml bottles is what is preferred. You have carried out web check-in, and you have carried out every packing that has, as per the government guidelines. And thereafter, start for the airport. In the cab, once you're sitting, the precautions start there. You have to wear your mask. You are preferably, please wear a face shield if you're carrying, and wear gloves. When you deboard from the cab, remove those gloves and enter the airport. When you are entering the airport, you will undergo thermal screening. The first thing they will do is check your temperature. There are a lot of concerns that it heats up the pineal gland and all that. It is, for the lack of any better term, absolute rubbish. So please ensure that the amount of exposure, the laser dot does not penetrate the skull at the weak. It is only to point. The thermal temperatures, they actually sense the infrared radiation from the body, and that is what is measured. Ensure that social distancing, this is a huge responsibility on the part of passengers, because this is where the airlines do not have control over. We cannot push, we cannot, stop them by hand. And ensure, and if you have printed your check-in luggage forms, if you have printed everything, then the entire process is supposed to be contactless. Ensure that it is such. The disinfection takes place of the airport complex, of the back-end offices, at least 3 times in a day. That is the mandate which is laid down, and they use hypochlorite. 1% hypochlorite. If not hypochlorite, ethyl alcohol, preferably hypochlorite. Every waste that you pick up with respect to your PPE, please ensure that you dispose in the biohazard bins, because they will be treated as such and they will be disposed as such. In flight, what is being done? Now, Captain Harpreet has covered quite a bit on this, but I'll just add on to what she said, that we are following something which we call as a zone system. The cabin crew is designated for a particular zone, so that he or she does not, only that person is exposed and the other people within the team are not exposed, to minimize the exposure. Cabin crew is wearing a 360-degree gown in all, gloves, face shield and mask, so that they are safe. On the part of passengers, when you are boarding in, you will be issued an envelope with a mask, a face shield, and sanitizer. Ensure that you please use this. Ensure that you are wearing it. It becomes very challenging for the crew on board to keep on insisting on people who do not wear masks, people who do not wear face shield. Yes, I do understand there is a little bit of claustrophobia involved when there is which comes in while wearing a face shield, but person can easily overcome the same thing. Wearing a mask is mandatory, it's not optional. So the crew are within their rights to deboard you in case you're not wearing the mask. The zones have been designated. If there is a sickness on board, now the crew initially used to do a cardiopulmonary resuscitation where they used to breathe into the mouth of the passenger in case required. That process has been done away with because of the risk of spread of the disease. Now we use something called as hands-only CPR. All the cabin crew are trained in this hands-only CPR, and they do that. If there is a sick passenger, the sick passenger is generally taken to the aft of the aircraft, that is the back portion of the aircraft, and kept by and large isolated in that part. One toilet is designated for the sick passenger, and one crew is designated for this sick passenger. And thereafter, the crew is trained on the actions as to what is done. In case a doctor's help is required on board, I would request, if there are any doctors on the forum, don't hold back in helping out, because the person may need a help. He is not a definite case of COVID. We have COVID kits on board. We have COVID kits on board, which gives you an N95 mask, which gives you a face shield, which gives you a complete PPE. The doctor is provided with these things, and they can wear it and attend to the passenger without any fear of contracting COVID. So these are the training and changes which have been incorporated in flight. Coming to post-flight, what happens? Now, this is where the state health authorities and the integrated district surveillance programs come in. Once a person lands in certain airports, the testing is done. Now, international travel, while coming in, people have been given the option that you do a COVID testing within 96 hours of departure. If not, if you have not done on landing, you will be that test will be done. If you are negative, you go home. If you are positive, you get quarantined automatically. So in case any of your relations or you have gone abroad and you are coming back, an RT-PCR test, COVID testing is mandatory. While before you travel from there, ensure you get it done. And suppose in domestic travel, a passenger tests positive sometime. He goes home, he has no symptom, he goes home, and he reports, or the district surveillance program reports that this person is positive. So the district surveillance gets in touch with the airport gets in touch with the airlines, and the cabin ventilation system you have just heard, I'll amplify on it. 3 rows forward, 3 rows aft. All the people, by aft I mean the backwards. So all the people who have been seated 3 rows front or back of that passenger are traced and requested to get their test done and put themselves on quarantine. So the state governments and the airlines are working together in this, and the airports, and it has really brought us a lot of dividends to identify people and get them quarantined so that we can prevent the spread of this disease. So that's where the contact tracing work has come in. Now, what happens if a crew on board tests positive? I mean, if a crew on diagnosis, I mean, if somebody is positive, the crew is quarantined at home or in hospital, depending on the state's regulation, for 17 days. Thereafter, There are DGCA empaneled class 1 medical officers who examine them and consider them fit for fly or not. Minimum period of downtime for them is 17 days. If somebody develops any symptoms in flight, obviously we can't divert, we can't, stop him in flight. The first port of landing that he goes, he reports sick. And thereafter, the testing is done. And if positive, the same rule applies. He gets quarantined for 17 days and then comes over. The challenge comes for the airline in terms of administrative issues if somebody tests positive on the layover. So we have to find a suitable hotel who will keep a COVID positive passenger. We have to arrange the accommodation. But that's our concern. That's not your concern. We are ensuring that they get quarantined and no COVID positive crew is flying an aircraft. As regards the COVID positive COVID testing for international airlines, every airline has been conducting their own safety risk assessment, and depending on the safety risk assessment, we have decided on different modalities of testing, whether pre-flight or 5 days post-flight. We are doing in Indigo, we are doing 5 days post-flight because we count from the day of exposure, and the chances of catching a person positive is maximum after day 5 of exposure. Now, this is one question which troubles everybody. There are articles which have said that small droplet transmission is occurring. People in the room air, in closed spaces, the chances of spread of COVID is very high. This is still under research. Having said that, I would like to tell 3 particular features within the aircraft cabin, which Mr. Deshmukh covered. This has to be reiterated so that it goes home much better. That I'll talk you through it as through this video. First barrier is the seating arrangement. None of the passengers are facing each other. They are all face forward. The seat back is a big solid barrier which acts. Second is the cabin ventilation system. The air always flows from top to bottom, goes through the high energy particulate air filters, which filter out 99.95% of the virus. It mixes with the fresh air intake, and then it is pushed back in. Every 2 to 3 minutes, the entire cabin air is exchanged. When I say this is much more efficient than the surgical operation theaters, in surgical operation theaters, every 10 minutes the air is exchanged. Whereas in an aircraft cabin, every 2 to 3 minutes the cabin air is exchanged. So if I say it is much safer than your malls. In fact, there are some studies conducted that it is 6 times safer than standing in a mall with the HEPA filters being available on board and the cabin ventilation system running. And that's why I reiterate that when the aircraft stops, please don't jump up and rush out. You are safe inside the aircraft cabin. You are safe because of the cabin ventilation system, which is a beautifully designed system. Now, coming to, there are certain cases where, the passengers have medical issues. They travel. Now, how do we clear them? All such cases are likely to come into contact with our wheelchair operators, our stretcher operators who are in close contact for a prolonged period of time with the medical case. We insist that the COVID testing is mandatory for such patients. We also ensure that our cabin crew are well trained in addressing the concerns of these particular cases and not to panic in case it's a respiratory case. There's one thing I just want to say one word about the air transport bubbles. International transport has not started to the extent that we would have liked. But air transport bubble concept is quid pro quo. I allow your airlines, you allow mine. It's as simple as that. Some airlines from India are allowed to fly to that particular country. Their airlines are allowed to fly towards the country. Essentially, what we are meaning to say is that if you have a testing system here, it should be acceptable to them. If I produce a COVID negative certificate for my passenger, it should be acceptable to that country. Their COVID negative certificate is acceptable to our country. Presently, India has got air transport bubbles with USA, UK, France, Germany, Canada, UAE, about 16 countries, and this number is growing. Hopefully, this will ensure that we are back on the international road. We are very hopeful of the domestic transport because India has a huge domestic transport. International transport is likely to take some time, but it matters. So whenever you want to travel, my advice is first check out the airline website. All the airlines are making double the efforts to ensure to update the information on their website. The next thing you need to check is the Ministry of Health website and the Ministry of Civil Aviation websites. These are the things which will give you the correct information. I would say it is pretty safe to travel, and provided you follow the measures that we have just enumerated, and we can take it forward from there. Thank you for this opportunity for speaking.
Thank you, Dr. Nageshwar Rao. Thank you so much for getting rid of so many myths and disbeliefs that people had prior to your coming in here, and clarifying all the doubts that people had from the medical front. We next have Dr. Punita Masrani. She will talk on the fears and psychosis that people have in traveling and how they can be addressed. Dr. Punita Masrani is also a specialist in aviation medicine and a medical review officer and a senior aviation medical examiner for various countries in the world. She is an academician of the International Academy of Aviation and Space Medicine and a fellow of the Aeronautical Society of India, Indian Society of Aerospace Medicine, and Aerospace Medical Association, United States. Dr. Punita Masrani. Well, there seems to be a slight audio fix with Dr. Punita Masrani, but I think she's getting it sorted out. Please have some patience, everybody.
Can you hear me now?
Yeah, it's visible.
Okay. Sorry for the technical issue.
It's fine. It's all right.
Thank you so much, Mr. Chawla, for your kind words of advice. And Mr. your audience is very patient towards you.
Ma'am, you're not audible.
Can you hear me?
You are not audible. Your volume is too low.
Can you hear me?
Maybe if you could keep the mic closer, it will help on the right side.
Yeah.
Better? Can you hear me?
Slightly better.
Am I audible now?
Yeah.
Yes.
Okay, perfect. Can I go on?
Yes, please.
Yeah.
Okay. So did this bring in a lot of fear in me? Well, it did worry me a bit, but not fear. So my topic for you today is fear. And I'm going to take all of you out of the aircraft, out of the airport for some time, back into your homes or offices where you are, and talk a little more about yourself. Most of us, as we all are right now, are in a state of equilibrium. If you look at these spots here, you have 3 pots here in front of you on your screen. This pot has a wide base. The other one has a slightly narrow base. And the third one is tall with a narrow base. Now, why am I showing you these spots? If you can see, all of these spots have an internal stability of their own. They are all in equilibrium. They are all the way we have kept them right now because they are strong and they're made that way. Now imagine if there were an external insult on these spots. which means if we assume these spots to be us, and if there is an external insult in the form of some anxiety, some stress, some fear, or some problem, what will happen to us? Maybe if our internal stability is not good enough, we could fall, we could damage or hurt ourselves. With COVID going around everywhere since the last 6 months, there has been a lot of fear in our minds. We keep seeing that a lot of cases that are increasing by the day, people are having more and more difficulties. There are people who are asymptomatic and could be carriers. I don't need to enlist the reasons why we have fear of various kinds. Now, let me tell you what really happens to your body when you are exposed to fear. If you are in a state of anxiety or stress or fear, then there are certain hormones that are secreted from your brain, which are the norepinephrine and dopamine. And your kidneys and adrenal glands will secrete adrenaline. Why am I telling you all this? Because these hormones will create certain changes in your mind and in your body. Your pupils in your eyes will dilate. Your heart starts beating fast. You start breathing fast. You get a little nervous. And your immediate reaction is whether to fight or to flight. This is common physiological reaction in any situation in human beings when you're exposed to a stressful or a fearful situation. Or as a doctor, if I can say, that's how we are wired. But do we have to stay like this? Stanford University Department of Neurobiology and a lot of other research universities and laboratories across the world have confirmed that our brain and our body have a capability, what we called neuroplasticity, which means that despite the way our body is made, despite the way our hormones are, despite the way we normally and usually tend to behave and react, we can override all of these reactions and situations. The brain and the human body is made in such a beautiful way that it allows neuroplasticity. What is neuroplasticity? It means that if we choose that we want to behave differently, we want to react differently, we want to train ourselves differently, we want to handle situations differently, then with patience, with practice, and with determination, we can do it. And that brings us to the concept of well-being. If we decide that we want to maintain our state of well-being, despite of the fact that there is a COVID pandemic going on, despite of the fact that we have to travel by air for whatever reason that is unavoidable, or whatever the reason of our travel, or even going to work for that matter, it is very, very important for us to maintain a state of well-being. And when I say well-being, I essentially mean an internal state of well-being. Let me explain this to you a little more in detail. Our well-being can be compared to our dining table, which has 4 pillars or 4 legs. The first one is the physical well-being. The second leg is the psychological well-being. The third is the social or the environmental well-being. And the fourth is the spiritual well-being. Let me explain all these to you in a little more detail. The physical well-being is very, very important to us. There are 3 main pillars of our physical well-being: our sleep, our diet, and our exercise. It is very important for each one of us, despite of whatever our work schedule may be, despite of whatever the stress or the troubles that we may be going through in our personal or professional lives. Everything said, we still have to remember that sleep is important, because sleep is restorative. It relaxes us, it energizes us, and it rebuilds us. It is very, very important to sleep adequately and remember, preferably as per our biological clock. Watching Netflix till 4 a.m. in the morning and then sleeping until noon just to make it 8 hours is no good. That's not the kind of sleep that our body needs. Research at Stanford University Department of Neurobiology indicates that there should be no lights on our eyes from 11 p.m. to 4 a.m. to be able to derive the benefits of restorative sleep. That is because our body needs to relax during that biological period of time. Good sleep helps us to learn new things during the day easily and also handle situations more effectively during the day, which means that if we were to be exposed to some kind of stress at work or in travel, if we have slept well, our body will be much more equipped to deal with those situations because we will be more alert and energized. When you wake up after a restful sleep, it is very important that you let light come into your eyes. You walk around your house or wherever you're staying and do some light exercises. Why am I asking you to do this? Because we all need what is called the cortisol in the morning. Cortisol is a hormone, again, which is produced by the body when we expose ourselves to sunlight and once we start moving and walking. When this cortisol in the body is released, it gives us the energy. It gives us the control to do the work that we need to. And the best thing about this morning cortisol is that it depresses one part of the brain which tends to react when we are stressed. So if we have given the body the morning cortisol, then we will not be as stressed or as worried or as worked up as the day progresses and we have to meet its challenges. Equally important as sleep is having wholesome and freshly cooked food. When we eat our food, we are always in a rush. We are discussing, we are watching the news, we are watching TV, we're checking our phone messages, we are worried about the next agenda. That actually spoils all the fun of the food. It is very important for our physical well being that we eat with peace and with an attitude of gratitude. We remember to chew our food well, to appreciate the food on our table, and to connect with the food that we have. That is how the food will nourish and nurture you and improve your physical well-being. So, as sleep and diet, exercise is also very important. We all are busy, and with the current problems of the pandemic, when we cannot go to the gyms or it's not very easy to go for after morning walks and exercises and all that, it's always possible to have exercises at home. The idea is to keep your body in motion. The idea is to have some discipline and not to have a sedentary lifestyle. Why am I insisting so much on physical well being? The reason is that when we have positive physical well being in the form of sleep, diet, and exercise, again, the body releases what we call the dopamine. Dopamine is a hormone released by the brain. And why do we need this dopamine? Dopamine gives us energy, it gives us motivation, it gives us a sense of reward and achievement and satisfaction, and it helps us achieve our outward goals in life. Which means if you've exercised, you've eaten well, you've slept well, now you go into the challenging world of today, your body is a lot more prepared to meet its challenges. And even if you have certain stressful situations, difficult situations, fearful situations, it'll be so much easier for your body to be able to meet those challenges. Instead of getting agitated, instead of getting worried, instead of getting bogged down with these challenges, you will be able to take it on more positively. A word about immunity and physical well being. Science has proved that some amount of stress is good for us. Acute stress or short term stress makes certain changes in the body, which actually works better on our immune system and it improves our immune response at that situation. Which means if you get worried that, yes, if you go out unprotected without a mask, you could get the virus, yes, it makes you stronger, it makes you alert, it makes you wear the mask and go out. But if you're going to let yourself be exposed to the stress constantly over a long period of time, just getting worried and worked up about it, then you're exposing yourself to what we call as long-term stress. And science has proved that long-term stress always works negatively on immunity. It lowers down your immunity significantly. And we should take every precaution not to do that because this is in our hands. We should be careful. We should be conscious that we do not let this long-term stress and fear set into us because we need our immunity in these challenging times. So at the end of the physical well-being, I would like to emphasize the importance of adequate sleep, healthy diet, regular exercise. We next talk about the second leg of the well-being, and that is the psychological well-being. What do you mean by psychological? It's the way you think, it's the way you behave, and it is your attitude towards life. How do you take challenging situations? How do you react to a situation? Or rather, do you act or do you react? Most of the times, we just react. We are in a state of panic. We get paranoid. If somebody asks us something, we get so touchy and we get so worked up with certain small things which are not as significant as we make them to be. So it's very important to build our psychological well-being. We need to calm ourselves down. We need to be more confident with ourselves. We need to be more in love with ourselves and our lives and trust our lives that it's okay if things are difficult. It's okay if things are bad, but this too shall pass. Let me learn from it. Let me take this as an opportunity to evolve myself and let me be a better human being and a better individual. The third leg of well being is the environmental well being. We are all social animals. We do not live in isolation, and we have the world around us, our immediate family, our support system, and the world around. With all the negative news pouring in all the times from people around nationally and internationally, it really worries us as to what is happening. Things are beyond our control. We are not able to handle situations. We are not able to get the support of people. And with social distancing and the lockdown, you don't even get to meet your loved ones. You don't even meet to get your parents, your children, your family. We don't have social support. We don't have domestic support at home. We have to do all the work ourselves. These things have created a significant stress on all of us, but it is up to us to see that we can rebuild these connects in our own ways because this is a time to be socially together in mind and spirit. We have various technological advances which help us connect with our loved ones and our colleagues. And it's very, very important for us to reinforce these bonds because social well being is very, very important to all of us. In fact, social well being gives us a sense of peace, it gives us a sense of calm, the sense of comfort that you have somebody who cares for you, who looks after you, whom you can always reach out to if you need to. This kind of an emotion or feeling in you releases a hormone called serotonin, and serotonin gives you that chemical sense of calm and well-being. It has a soothing effect. And in stressful times when otherwise we tend to always be agitated and worried, this hormone is like the balm on us, which actually helps us deal with the whole situation better because it's very reassuring and it's also very calming and supportive to all of us. Serotonin also gives you a sense of well being within yourself, within the environment that you live in, within the society that you live in, and with the world in general. The fourth pillar is the spiritual well being. I want you to take a look at these spots once again. They're all different in shape, sizes, forms, and sometimes colors. They all seem different. Do you see anything common in them except clay? The air. The air in all of them is the same air as the air outside. They are connected to the outside air and therefore full and, in a sense, the same. The same oneness of the divine energy that creates and fills all of us with plenitude, grace, and abundance. When we unite with these oneness, we cannot but be grateful for life with all its challenges because that divine energy gives us strength, peace, and certitude. We may not be on our own spiritual paths, and yet it is important for all of us to connect to the spiritual oneness because, as I said, the peace, the strength, and the certitude that gives us a different energy, a different power, a different confidence to get over our fears, to get over the challenges of these tough times during COVID and even otherwise. So we now have all the four pillars of the well-being: the physical, the psychological, the environmental, and the spiritual. And when we have our well-being intact, what does it do to us? It creates a wall of immunity around us. It builds up our aura. It creates a strength such that whether it's the virus or it's any other acute stress or it's financial worry or whatever it is, it gives us a different strength. It gives us a different capability to be able to meet those challenges, to be strong in mind and body. And when we are in a situation like this, even if we are in an environment where another person may have the virus would not affect us. Even if it affects us, our body would be strong enough to fight with the virus. Even if we get the infection, it'll still give us a lot of strength to be able to recover from it very fast. So it is extremely important not to allow fear to come into us, because fear tends to weaken us, tends to weaken our immunity. And therefore, in this situation where all around we tend to see fear, some of it which is imaginary, it is important for us that we keep our well-being, our physical, psychological, environmental, and spiritual well-being strong, because this is what really helps us to fight, to keep ourselves safe and strong during these times. So instead of living with fear all the time, we need to replace the fear with the PPEs, that is physiological, psychological, environmental, and spiritual well-being. When we are in this state of well-being, we are in a state of equilibrium that we discussed in the beginning. Our internal stability is much stronger. And therefore, when we are in an environment of the aircraft, where, as all my esteemed speakers have mentioned earlier about all the precautions that the airline and the DGCA and the doctors and the staff and everybody is taking to keep you safe in the environment, you have to wear your own PPEs to keep yourself safe in this environment. Flying can have its own fear and its own psychosis because you are in a confined space. You are in a claustrophobic, so to say, environment where you're not really in control. You just have to wait to take off and land. You're not in control of the aircraft. But this is the time when you can be in control of yourself. And besides the physical PPEs that you're all, as Dr. Rao said, it is mandatory for you to wear these PPEs on you while traveling. It is equally important to have your personal PPE, which is the physiological, the psychological, the environmental, and the spiritual well-being. Because with these two PPEs in place, I can assure you that flying would be a lot safer. Thank you, and I'm happy to take any questions if there is any.
Thank you, Dr. Punita, for those valuable insights. I mean, a lot of takings for all of us. Specifically, the importance of the state of well-being and the health tips during pandemic. You have sort of highlighted them in a very good way. Obviously, the personal PPEs combined with the physical PPEs, these are a couple of things which will make the traveler much more safe, and the journey can be much more of a better experience, both physically and mentally. Moving on, we have got our final distinguished guest of the day, Mr. Vinod Shukla, who is currently HOD GoAir Engineering Training Center. In his extensive 23 years of experience, Mr. Shukla has worked for many aviation departments that include training, line maintenance, MCC, quality, and continuous airworthiness management organization. In his capacity as an AME, Mr. Shukla has shown proficiency in maintaining flying machines likes of A319, 320, 321 CEOs and NEO with engines like CFM56, Pratt & Whitney 1100Gs. Other aircraft fleet include those of CRJs 200, Falcon 900 EX Easy, and Cessna 152. Qualified as an MBA in operations from NMIMS, his strong management ethics has led him to chair multiple positions on high regards like head of Camo division and DGC approved post holder. He has also conducted various type trainings for engineers on A320 family aircraft and CRJ series aircraft through his long career. Now, Mr. Shukla comes with heavy artillery for this presentation, and I'm sure that you all are excited to hear the technical insights related to the aircraft cabin filtration systems. So I would request Shukla sir to shed light on behind the scenes of work that goes into keeping the passengers disease-free at 35,000 feet. Over to you, Shukla sir. You can start screen share. Thank you.
Yeah, hello everyone. Good afternoon. It's my privilege that I've been called upon to have my point of view on this topic. It's a very, very interesting topic as on date for every passengers trying and planning for flying in near future. So our esteemed panelist has already discussed about the technical aspects, medical aspects, psychological aspect of it, and given how safe is the flying and what all the precautions need to be taken at different stages, right from the airport to inside aircraft and even at the time of evacuation of the aircraft. Now, I'll be taking through the technical journey through visual definitions, where we'll try to show you how technical arrangements are made on aircraft to make sure that you are getting a clean, recirculated, fresh air, and that is safe for you. So we'll go through step-by-step technical arrangements on it. As on date, every one of us is planning to have a holidays, because coming near future, all holiday season is coming for every one of us, and our main concern is to danger of getting infected when we are trying to fly from one place to another place. So I'm putting you some facts and figures and information, particularly technical information. As far as cleaning, deep cleaning, sanitization, these aspects are well covered by every airline, and they are done in minute detail that no area, no point is left out for cleaning, disinfection is concerned. So I would like to ask some question from you so that we can develop some concept of it. So first question would be, from where we are getting this air when we are sitting in the air inside aircraft, from where we are getting this air? Mr. Subhashis, can you put an audience poll and we'll say the viewers' view on that?
Sure, there you go. So all the participants, kindly let us know your views. Yes.
Okay. So can we show the results of the poll?
Yeah. In the people have got still 10 minutes to think on it. Yeah.
Okay, fine.
Sorry, 10 seconds. My bad. Yeah. Host, can we have the results now?
Yes. So here is the result in front of us, where we have found that around 25% of people is thinking that air is directly coming from outside and directly supplied to the cabin. Around 58% of the people are thinking that air is coming from APU or engine. And some is saying same air is recirculated, around 17%. So we have got a split of the opinion. And if we see further, we can see that, yes, the air which is freely available outside of aircraft at height, if you see, it's minus 40 degree on ground level outside aircraft, they are coming and pressurized as already discussed by my earlier technical speaker, that these airs are coming and compressed by engine compressors. So all the air is going for developing thrust for the engine, but some portion of the air is taken out, that is called bleed air, and it is supplied for the cabin. Similar arrangement when you are on ground and engines are not running. So at that point of time, there is a small engine at the tail of aircraft that is called APU, auxiliary power unit. And this unit also take outside air, compress it. This is there for giving you the pneumatic air conditioning system as well as the electrical power on aircraft when engines are not running on ground and when boarding is going on. So these are creating a compressed air, and that air is taken out. So while compressing this air becomes very, very hot, more than 100, 200 degrees Celsius. So nothing will survive after that. So this compressed air is taken out through different valves arrangements, and they are supplied for the cabin. So you can see on the side diagram that either from tail area of the aircraft, that is APU, or from the engine, air is coming for air conditioning system, and this is controlled by pneumatic system computers known as bleed monitoring computers. So we are getting air, outside air, minus 40 degree at high altitudes, or at a ground level also. All air is compressed to very, very high temperatures, and then it is supplied for air conditioning system. That means air which is already heated to more than 200 degrees Celsius is now getting cooled. So what we are doing is, we can see here, I know this is a normal, we are addressing to all normal people who are not technical experts, but we'll just try to give them some glimpse of that technical arrangement. So what we see here, from engine, left engine, there is a valves which are taking air either from IP valve or HP. This is called intermediate or high pressure, depending on the engine RPM. We need to have a sufficient pressure available. So we are tapping this from this point, and through different valve arrangements, ultimately going to the pack. What you can see here, pack 1. That is called air conditioning pack. Similarly, the other engine number 2 is also taken supply of the bleed through different valve arrangement controlled by computers. And finally, it is given to the pack 2. Even in one engine is not there, no problem. We have got a cross bleed valve. The bleed from this side can also be given to pack 1, or bleed from this side can also be given to pack 2. If both engines are not running on ground, as we are doing boarding, at that time we have got APU arrangement, which is we are taking bleed from there and supply to the packs 1 or pack through cross bleed valve arrangement. And in case APU is also not there, then we can have a ground pneumatic card which can supply bleed. So for the air conditioning system, we are taking, can you see the red color here? We're taking very hot bleed, which is coming to pack for cooling purpose. So the source which is coming is a very hot bleed, and then it is going to arrangement of a cooling. So from the cockpit point of view, if you see, pilot has got selection of engine 1 bleed or engine 2 bleed or APU bleed. So he can select, and he can select selector valve like cross bleed valve, open or shut position depending upon the requirements. Apart from that, some cases are there, like it's a very extreme case when engine bleed is not available. At that time, what will happen? Both engines are not there. So at lower altitude, pilot has options to open a ram air valve, which is taking outside air and directly ventilating your cabin. That is called ram air supply, which is extreme conditions, what you call emergency condition situations. Now, further, if we see in simple words, I can simply say that bleed is coming from either of engine or APU and supply to the packs 1 or pack 2. So we have got 2 air conditioning pack on the aircraft. So if we see the pack arrangement, so can you see on the left side diagram, we are taking a bleed from the engine through flow control valve, and they are going to the 2 pack 1 and pack 2. The purpose of the pack is to cool the air. It maintains the required amount of pressure, temperature, and it removes out any humidity or moisture available in the air. So the right mix of temperature, pressure, humidity is made available through pack, and this pack are supplying to a common manifold, and that common manifold is called mixer unit. So from the mixer unit, now air is distributed to different region of aircraft. So if we see from this diagram, we can say that from mixer unit, both packs are supplying to the mixer unit, and from the mixer unit, air is going to the forward cabin, that is for cockpit area, then forward cabin, and then we see aft cabin. So different zones are there where cold air is circulated. Now, depending on the selection, pack can maintain the same temperature, but say suppose we want different temperature in different zone, forward zone, aft zone, mid zone. So for that region, we are taking a hot bleed air and tapping from both sides and supplying to trim air valve, and then it is controlled through trim air valve here. So amount of hot air can be mixed with the cold air supplied from the pack, and they are trying to mix optimum temperature. That is called conditioned air. That's why it's called air conditioning. We are trying to condition the air as per the requirement by mixing hot air and cold air together. So depending on the selection here, pilot can select this trim air valve, and say suppose, for example, in this diagram, say suppose pilot has selected 18 degree, in that case, no need of adding hot air here. So trim air valve is closed. If he has selected 22 or 25 here in different zone, yes, he can do that by selecting the trim air valve to different position. So hot air is added to make a conditioned air available in aircraft right from different zone of aircraft. Now the question might be how this cooling is done. I have shown you a simple box like pack 1 or pack 2, but yes, it's a more technical on that side. I'm not going to discuss much on that, but I can simply want to say that like this box is represented here as this diagram. So I am taking a hot bleed air, a portion of it is going for trim air supply like here, And this arrangement of heat exchangers, ACM, air conditioning machine, reheater, water extractor, and condenser, this technical arrangement is making so that hot bleed air is get cold and coming out of a mixer unit, and that is supplied here in this mixer unit. But all these valves, opening, closing, monitoring is controlled by a very advanced computer. They are called air conditioning system controllers. So we have got two controllers having 1 and 2 supply and supplying conditioned air for both the packs. So if we go further, if you want to see visually where they are located on aircraft, just as a layman, as a passenger, you might have this query in your mind. So if just a repetition of the same, here pack is supplied and hot air is supplied here through trim air valve in the different zone. So how it is look like? Just see what I was trying to tell you. The air conditioning pack, what I'm talking about, cooling the air. So these are heat exchangers. Then we have got ACM, they have got water reheater and water extractors. So this arrangement is the belly of the aircraft. So at the bottom of fuselage, we have got a 2 packs left side and right side. They are arranged to supply you the cold air. Now, below the floor, where you sit, below the floor, there is a cargo area, and behind the cargo area, there is a mixer unit. So all the air from both the packs are coming to the mixer unit. What you see as a red, orange color duct is a hot air supply, which is mixing for cold air to supply you conditioned air. So here we can see in more detail. It's just a visual information. Nothing details is required. So this is your air cycle machine, which is mainly doing the cooling function of air. And here is your trim air pressure regulating valve, which is supplying hot air for mixing. And this is your mixer unit coming from both the packs, left and right pack. So if I see here, yes, pilot has to do this selection. So as far as pilot is concerned, from the cockpit, pilot will do the selection here, cockpit, forward cabin, and aft cabin. So he can select cold, he can select hot, he can select normal here. So here, when I say green normal, that means 24-degree temperature selected. So as he does the selection, then accordingly hot air valve will open and air will supply at different temperature. So he can visually see from the cockpit indications that yes, the valve is partially open or closed, hot air valve is open or closed. So he can select this hot air valve from here, switch, and this valve will open or close. And once it is open, then he can do the trimming function. If more or less passenger there, he can do the high flow or low flow. And also he can select pack 1 or pack 2 off or on. So these are the controls available for the captain in the cockpit. The right temperature into the cabin and cockpit areas. Now, pilot is doing selection from the cockpit, but a small trimming of the temperature is required. Sometimes some passenger saying I want some little hot or little cold. Then even cabin crew has got authority from the panel available, that is called FAB. And from here, cabin can do whatever selection done by the captain, plus minus 2.5 degree selection or increase or decrease can be done by even cabin crew sitting in the cabin area. So need not to just for a small adjustment for the temperature in the different zone. So these are the panels available in the cockpit for air conditioning system, and similarly the temperature selection possible from the FAB for the cabin crew. Now, if I see, so these are the diagram which I have told you. Yes, so these are the supply and how they're supplied further. Now, next question is, we have got a cold air coming to the cabin area, which is nothing but pressurized air taken from the engine and airflow. My next question is that, okay, once this air is there, how much time it will remain in the cabin? That is my next question. Everyone might have asked the same question. How much time it will remain? As already discussed by our other speakers, that it is refreshed very fast. How it is refreshed very fast? How it is thrown out of aircraft? I need to tell you. So my next question would be, can you create a poll, Mr. Subhashis?
Yes, sir. We'll do
let's
that.
see. Yeah.
Right. Perfect. Yes. Okay. So the question is, like a closed room, is the same air inside the aircraft cabin reused again and again? Your options are yes, complete air is recirculated. Your second option is no, air is not recirculated. Yes, only partial amount of air is recirculated. So yeah, you all now have got 15 seconds. Yeah.
Yes. We are getting good mix of the
Yes, responses. Yes.
Really nice. That's why you need to have a clear understanding of the concepts.
Yeah, these are the results. Sir.
So what we have seen from the results, because these are the people going to fly, their concept need to be very much clear on the concept, technical elements inside the aircraft. So we have seen that, yes, 30% of the people are saying no, air is not recirculated. 26% saying complete air is recirculated again and again. And 41st majority, we can say that only partial amount of air is recirculated, which is true. Now we'll see how it is recirculated. So the complete air is not recirculated. What we are circulating is a partial amount of air. So if we see here, the air inside the cabin, as already discussed by doctor on the panel as well as technical expert, that it is refreshed every 2 to 3 minutes. And that means in 1 hour time, 20 to 30 times the air is refreshed inside the cabin. And if we do a comparison from the hospitals, then in hospital room, heat is, this air is exchanged every 10 minutes. That is only 6 times. No, I'm not comparing, but just trying to make sure that how safe is the cabin. So it is done every 6 times per hour, where in air offices, it is done every 20 minutes. As a comparison, we just want to see, and it is done 3 times per hour. Whereas cabin in the air in the cabin is refreshed or changed with the new air every 2 to 3 minutes. That means 20 to 30 times in 1 hour period. So what is happening? How it is getting replaced? Now the question is that might have got in mind. So when air is coming from the engine RFU and adding more air into the cabin, then calibrated amount of air is thrown out of aircraft. How it is thrown out of aircraft? Because we, as our panelist, technical panelist already expressed, that we want to maintain a pressure in the cabin, because aircraft may be flying to 30, 35,000 feet, but we are trying to maintain cabin of 8,000, 7,000, 5,000. So depending upon the pressurization cycle of aircraft, as climb, cruise or descent altitude, we are trying to maintain certain amount of pressure inside the cabin, and that is maintained by pressurization system of aircraft, controlled by a dedicated computer known as cabin pressure controllers. So what they are doing, the calibrated amount of air is thrown out of aircraft through a valve known as outflow valve. This outflow valve is taking out the air and throwing outside, and fresh air is coming. So what is happening? If I take all the fresh air out and all the old air out and fresh air coming, then I need to have more and more bleed tapping from the engine, which will increase my fuel consumption, it increase my EGT of aircraft, all those things will happen. So they have taken a partial amount of air from the cabin, is recirculated and reused. And some air is thrown outside every time through a valve known as outflow valve. So we can say that as new air enters in the cabin, some calculated quantity of used air from the cabin is expelled overboard by a pressurization outflow valve installed on the aft of the aircraft. Now, every time when we are setting, we are getting a either fresh air or recirculated air, which is filtered. Now we'll come on next on the how filtration is done, but fresh and filtered air, recirculated air is a mix of that we are getting into the aircraft. So just to have this data what we have discussed here, the IATA agency has already announced this. The cabin air is fully renewed every 2 to 3 minutes, which is technical information passed for public. Hospitals every 10 minutes and officers. And cabin air is mix of the air for fresh and recirculated. The recirculated air is coming through a great filtration system. I will come back on the filtration system again separately. We know the name. As of now, we can say that HEPA filter, and which is very, very efficient filter. Now, where is thrown? So if I see this diagram, on the aircraft tail area, you'll find, here is your APU. On the tail area, you'll find a one valve that is called outflow valve. And this has got gates. These gates are electrically controlled, motor controlled valves are there. They are controlled by computer trying to maintain a pressurization schedule in the aircraft and throwing air from this air. And if we see behind this valve, there's a duct which is throwing air outside of this. And the used air which is mix of other, exhalation of the passengers are thrown out from this valve that is known as outflow valve. Now the next thing is, okay, from outflow valve, we are throwing air, but partial amount of air we are reusing. So some air from the floorboard area, in all along the fuselage, on the passenger seat, near the floorboard area, air is sucked back, and then it is sucked back through a fan known as cabin fans. These cabin fans are sucking the air and then mixing to the mixer unit. You might have got question in mind, what about filtration? Yes, it is there, not shown in this diagram, but after that there's a filtration. I will come on the next. So partial amount of air is coming through a fan that is known as cabin fans, and they're sucking some portion of it and mixing. So pack is supplying fresh air and some partial amount is supplied back to the mixer unit. Now, yes, so what we see here, can you create another poll, Mr. Subhashis, that
yes,
how filtration is done, how pure this filter should be, how much purity it has?
Sure. So the question goes like this: is the recirculated air entering the cabin filtered? The first option is yes, it is 99.99% free from virus and other particles. No, it is not filtered at all. Please let me know your views, participants. I think Dr. Nageshwar Rao sir has already
Very well
highlighted on this.
Yes. So right. Now that's what the purpose of this seminar, that people should get educated and get confidence on the technical arrangement on the aircraft.
Sure.
So we have achieved this objective of getting 100% result over here. Sure. And thanks participants, that we have got 100% result in this question. That yes, air is filtered. How it is filtered, we'll see it is later. So the air which is coming here, this is your on my previous diagram, if I show you here, in the mixer unit, air is sucked and then supplied to mixer unit. So in this diagram, this brown color thing, what you see is a mixer unit, and this is a recirculation filter. So air is sucked, filtered, and then fan is sucking there. This black color, what you see is a fan. So first it is filtering, then sucking, then supplying to the mixer unit. So this is below the floorboard. When you sit in the cabin, below your floorboard, there is a cargo compartment. On the side of cargo compartment, you will find this arrangement. That is a mixer unit having a recirculation filter, and then fan which is sucking. This black color, what you see on both the sides, is a two circulation fan, and these are two recirculation filters. So they filter and then come here. Now the question is, how efficient is this filter? Filter may be there, but how efficient is this filter? Now the question is, this filter is a very, very efficient filter. I'm just trying to show some diagrams, then I'll go on the filtration part. So the air from here is coming to you. You are sitting on these chairs. From the side, the riser ducts are there, which is rising this air and throwing on or overhead. And then it is moving down, and at the bottom of your floor, it is sucked. So whatever used air is there, it is sucked from there. So these are the arrangements from where air is coming up and throwing on overhead. So if you see here, as it moves from top to bottom, as Dr. Nagesh and other technical expert has already explained, that air is moving from top to bottom, not horizontally in the cabin. So a fresh air is coming from my head and going down below the floor. For the next seat, next fresh air is coming from top and going down below. So we can see that on each set of rows, there's a complete fresh set of air is coming from top to bottom. That is the beauty of this design of aircraft, to have the fresh or clean air available for each set of rows. So the air in the aircraft flows from the top to bottom at 1 meter per second and subsequently removes to the floor. And the flow is optimized to prevent longitudinal movement. So no forward to aft movement top to bottom movement is there, and there is a no spread between the adjacent row seat. So this will help to reduce the possible spread of virus. As far as tech, it is not because of pandemic. It's already right from the beginning. Design is such that the airflow is from top to bottom, so that no lateral movement of it there. So the breathing air or any contaminated air should not go on the next row or should not affect other passenger. That is the beauty of design, right from the design of aircraft. Now, if I see here, yes, the air coming through the riser ducts, coming through these tubes from the top and throwing this air. And from the bottom, this air is coming and sucked through. So where it is sucked? Sucked through a filters, that's called HEPA filter, sucked by fan known as cabin fan, and supplying to a mixer unit, which is a fresh air is also going over there, and then redistributing to different cabin. And majority of air is taken out through a wall known as outflow wall, which is aft of the aircraft, and controlled manner they are throwing the air out. Now, if I see further, so what I can see, yes, from the different zone of aircraft, air is sucked here, then first it is filtered, then through cabin fan it is sucked, and then given to mixer unit, which I have already discussed. And packs are supplying fresh air and going to mixer unit. And from mixer unit, yes, the air is going to the cockpit, forward zone or aft zone of aircraft. Now, if I move further on, then how efficient is this filtration? That is the question. Everyone knows that, okay, HEPA filter is there, which is very good filter. How efficient is this filter? If I say here, the HEPA filter, high efficiency particulate air filter, is capable of capturing virus which has size range of 0.003 to 0.1 micron with a more than 99.99% filtering efficiency. And we can see that, okay, this virus attached to some droplets or something which are bigger in size. If I see only virus also, then also the micron size is such that it will filter the virus. The virus is not only attached to droplets of less than 150 micron, which enables this virus to float in air. But as we see, the filtration of the capacity of this filter is very efficient filter. It not only purifies the virus, it will purify bacteria, atmospheric dust, and other things that can also be filtered. Now I will show you the technical specification of this filter. Now you see the HEPA filter, how pure is this filter? So as just for your knowledge purpose, you see the 0.001 to 100 micron size. So these are the various size. So virus is from this range to this range, size of the virus. Tobacco smoke, then bacteria is ranging from this cell, valence. So these are the various size particle of the various microbes. Now I'll show the filtering capacity of the filter. So as air is moving, so if I got a filter which is static filter, so air is static, so filtration will be better. But if I've got a flow of air, filtration capacity might slightly decrease. So normal condition, it has got 100% collection efficiency, HEPA filter. But the flow of air is 0.024 meter per second for HEPA recirculation filter, because fan is sucking that air. So there's a flow attached to the air. So the filter efficiency might get reduced. So I am trying to show you the diagram here that with the reduction of filtering efficiency with a velocity of 0.024 meter per second, on this graph, if I say the lowest particle size of the virus in micron, lesser is the number, bigger is the size. Small is the number, smaller is the size. Higher is the number, smaller is the size. So the smallest virus size, if I see on this diagram, it is touching over here, and across if I join, it is filtering with 99.9% efficiency with a HEPA recirculation filters on all modern aircrafts. So with flow attached to the air, even then the filtration efficiency is 99.99% for the virus, bacteria, pollens, tobacco smoke, everything. So that's how the beauty of filtration is there. Now if I go further, how the HEPA filter technology is coming. HEPA technology was originally developed by US military to prevent the spread of airborne radioactive contaminants, and has been installed, but now it is installed on all modern passenger aircraft since 1990s itself. Not now, it's this thought and things were there into design right from the beginning, long back. So if we see here, the HEPA efficiency 99.99% as far as virus filtration is concerned, it doing the filtration. How it is doing this filtration? Let's see this. So overall efficiency, if you see the air is coming here through HEPA filter, then there is a circulation attached to it, and then through diffuser, the clean air is going to the HEPA filter, and that becomes your very clean and virus-free air supplied to the cabin mixer unit, which is ultimately supplying to the cabin areas. Now, if we move further down, now see here, these are the different design of filter which I have shown you is one of the circular arrangement which is there. So this different design of filters are there. They are cleaning the air, and cabin air is as clean as operating hospital operating theaters. And recirculation is done in much faster way than in hospital. So that's what the beauty of this filtration system is. So that's called HEPA filter. So this data is from IATA, which is an international agency for the air travel and other thing. Now, the question might be there in your mind that, okay, all aircraft has got HEPA filters? Yes. So I will tell you, all modern aircrafts, passenger aircraft you see, all has got HEPA type of filters. Older versions of previous old generation aircraft might not have, but at present date, all modern aircraft has got HEPA filter arrangement, which is have very good filtration efficiency. The next question in your mind would be, okay, the filter, what about if filter get clogged? What will happen? I will tell you how often this filter is changed. So there are the strict guidelines, intervals given by the manufacturer, approved by regulatory authority, no compromise on that. On a given time, whether filter is blocked or not blocked, filter is replaced. Now, what happens? So the filter replaced every fixed interval, whether it's blocked or not blocked. That period is decided by manufacturer of aircraft and approved by regulatory authority of wherever you are flying, in India or any country. So that is 100% replacement part, and there is no compromise. There's no re-cleaning and reinstallation. No. Even then, when it is, say, suppose clogged, or it's flying in an area where a lot of dust or a lot of smoke is there, it's clogged well before time. If it is clogged, only the flow of air coming out, it will be reduced, not the filtration efficiency. Filtration efficiency will remain again as 99.9%. Only thing is the amount of air coming out of the filter will reduce. So that is what I want to highlight here. Filter is replaced on a given time interval, approved by manufacturer, approved by your regulatory authority. That's called DGC in India. Now, next thing which I want to tell you is, whatever I have discussed, let's see the pictorial view of the arrangement, that how the air is taken, how it is filtered, how it's supplied to you, so that you have got a visual understanding of what we have discussed. From where air is coming, how often it is replaced, and how it is filtered. So let's see that. So air coming from engine APU through a tension pack, through HEPA filters. So elements are there across the pipe. And can you see this? Can you see this outflow wall? The air is coming out of from here outflow wall. So from outboard, the bad air is going out here from this wall. So the air coming in the cabin, going from the top to bottom, and then recirculator from the bottom, which is replaced every 2 3. So in each row, we are getting fresh set of air, either fresh air or recirculated filtered air coming and joining, giving you air. Then from here, moving out, majority through outboard, and some of it is used through filtration system known as HEPA filter, which can clean up to 99.9% job. Okay, so now we'll see further in the further future development. Because of this pandemic and COVID, some more developments are coming up in the design of aircrafts, and all manufacturers will slowly adopt these changes. So they are coming with a shielding surface with antimicrobial coating. So surfaces are all the surfaces in the toilet, in the galley, in the other area, in the overhead panel. They are coming with a new kind of shielding. So antimicrobial surface is make it hard for microbes such as virus to grow aviation manufacturers are evaluating existing products while collaborating with the researchers and trying to develop such shields. So in future aircraft, such surface will come where virus or microbes will not attach to it. Then they are using ultraviolet light for augmentation of disinfections in the cabin area, in the toilet, in the galley, in all areas. And they are also coming with a self-disinfecting laboratory. So aviation manufacturers are working on the development of self-disinfecting laboratory prototype using ultraviolet light, which can disinfect about 99.9% germs. So these are the future developments which will come in the new modern aircraft as a preventive measures for this kind of virus and microbes. So with this, I just want to say technically that yes, welcome on board. And technical point of view, a lot of precautions you have to take. From technical point of view, this is the arrangement inside the aircraft. Yes, we do have to take your own well-being. You have to take precaution. You have to optimize the spread by using mask and doing all social distancing. These are the things we need to take precaution along with the system design. So thank you so much. If you have got any questions, you can have a question with.
Thank you, Shukla sir, for that valuable technical insights. And obviously, a lot of talks around the word HEPA, and today you sort of cleared that really well. Now let's moving on to our Q&A session, and the chat boxes are open for the participants to drop in their questions, and I will address them to the panelists one by one. So I'll request all the hosts. So yeah, the first question is coming from Shiv. So how social distancing can be made practically possible during boarding and deboarding of flights? So I think Dr. Nageshwar Rao sir, from an operational standpoint, how social distancing can be made practically possible during boarding and deboarding of flights?
It's a very relevant question. As I brought out in my talk a little while back, the biggest challenge is while deboarding. While boarding also, we do advise the passengers to keep a safe distance, but they tend to crowd in the aero bridges. They tend to crowd the moment they are getting down from the buses. So this is a combined responsibility between the airlines and the passengers to ensure that the social distancing is ensured. While deboarding, it is slightly easier only if the passengers keep sitting and row by row if they deboard, while if they are getting off to the aircraft. If everybody stands up suddenly and wants to get off at the same time, they'll obviously be clustering in the aisles and in the aero bridge and on the staircase, on the ramps.
Sure, perfect. Thank you, sir. So I think it is more from the passenger side as well, that they make sure that they follow social distancing to make the system much more, social distance proof, I'll say. So yeah, a lot of questions pouring in.
Further, I just want to clarify one more thing. Sitting inside the aircraft, we are extremely dependent on you wearing the mask, the face shield, and the cabin ventilation system. Social distancing is practically not possible while sitting inside the aircraft. The hue and cry which was raised to leave the middle seat vacant also does not meet your 6 feet distance. So we have added in an additional layer by putting the central aisle passengers wearing the PPE gown, but still it is the onus is on the individual to wear the mask and the face shield, and thereby ensure that some additional level of protection is available.
Perfect. Thank you, sir. I think the next question we have got in, particularly for HEPA filter point of view. So let me sort of bring that question up 1 second. So this is for, I think, Mr. Shukla. Mr. Shukla, is the compressed, fresh air also filtered with HEPA filters, similar to recirculated air?
No. Compressed air filter is not filtered. It is pressurized with the compression of engine or APU, and then goes to a system of heating and cooling. So that is fresh air. Once it is heated to more than 200 degrees Celsius, then nothing is left out.
Right, perfect. So the sort of quick related question to that is HEPA a quick detach from a maintenance point of view? So is it easy to detach HEPA filters during maintenance?
Yes, it is quite, but only thing you need to go into cargo area, open the aft panel, and after opening the panel, you get access to the recirculation system filter. So it's quite easy. Attachment detachment is not a big thing. Only opening, getting access over there is some time is required to open the panel. All screws need to be opened.
Right, right. Perfect. I think the next question is in context with the boarding card. So why give boarding card and not scannable through app? Why add that extra layer of possible contact? So why not paperless boarding cards on your mobile phones, and why not the printer, and why the printed one? So that will reduce one layer of sort of contact. Anyone from the
So
panelists.
this has,
Yeah.
I'll take this. This
Yeah.
has actually been done away with. Boarding card is only being given for passengers who have not e-checked in, who have not web checked in, who have not downloaded their boarding card. Once they come to the airport, only then these people are given a boarding card. Otherwise, no boarding card. It's on mobile based now. It's scannable. It is on mobile based.
Right, right. Perfect, perfect. Thank you for that, sir. The next question, I believe, fits right for Punita ma'am. So the question goes from Janvi Mapsekar, and it is like this. If a passenger is already suffering from the fear to fly, coronavirus being the addition to the fear, how can one overcome that?
Okay, Janvi, both these need to be addressed separately. Can you hear me?
Yes, ma'am, loud and clear.
Yeah, so both these have to be addressed separately. Basically, you need to meet a specialist, an aviation medicine specialist or a counselor or anybody in the industry who can first give you the confidence, because you need to identify the cause of the fear. Is it a previous incident? Is it a bad memory? Is it just an imaginary fear? What exactly is the cause of the fear? You probably have a tendency to fear itself, and that has to be addressed at the root cause level itself. And once that's taken care of, then I'm sure there will be a lot more faith and confidence in everything.
Perfect,
Does
perfect.
that answer your question?
Yes, that is what it is, ma'am. I think both of these fears have to be addressed separately. And as you mentioned, the state of well-being is also important. So during your presentation, so I think that fits. So yeah, Janvi has sort of thanked you for that. The next question, I think, could you comment on the reality behind the middle seat empty rule? Is it helpful? Have we got Deshmukh sir with us? I think, sir, from your years of experience.
Thank you.
Right.
No, it doesn't serve the purpose of keeping the middle seat empty. It is a psychological impression that having middle seat empty is better. But in the aircraft, it really doesn't matter, because the airflow pattern is such that wherever you are sitting, you are in the fresh flow of air going down. So it really doesn't matter whether you are sitting 6 inches away or a foot away. You are still safe. So middle seat empty really doesn't serve any purpose.
Perfect. And I think one more question is directed towards you, Deshmukh sir. Where else can HEPA filters be used apart from flights? So yeah.
You mean to say in the industry?
Yes, possibly that is what the question meant. Yeah, HEPA filters.
Hospitals, definitely they use the HEPA filters. But today, whether the offices will use it, it is quite expensive. HEPA filters are expensive and they need to be changed routinely. So whether the offices will opt for that kind of filtration process, we don't know. It is a question of capital cost plus recurring cost. So I can't say other industry, but airline industry definitely has, hospital industry definitely has a requirement of HEPA. And let me tell you that, COVID has come now. But before that, there were so many. Even in 2003, SARS was there, which was much more difficult pandemic. But the aircraft kept you safe. So it does make sense to have it in the aircraft or in the hospitals. But any other place which is open to atmosphere, it doesn't make much of a sense. So I don't think HEPA filter is an answer to everywhere.
Perfect.
As per the requirement.
Right, And I think there is one more question in the chat box, which I personally relate to as well. As the operating cost of the airlines have gone high during this pandemic situation because of the additional safety requirements out there on top of the already existing high operating cost in the airline business?
You are asking me.
Yeah, anyone can answer. I think I'll start.
Yeah,
with
yeah. The operating cost has definitely gone up. The revenues are way down. So operating cost because of everywhere. That means in the hospital, in the many of the offices where public offices, everywhere the cost of operating has shot up. And availability of manpower, like crew has to be quarantined. So all this has added to the extra cost. So I mean, that is going to reflect in the ticket price someday.
Nageshwar Rao, sir, your views.
Just to add on to what Mr. Deshmukh was saying, the operating cost, whenever the aircraft are on ground, the costs increase for the airline. I mean, we have out of 280 aircraft, we are just for 70, 80 aircraft are flying at this point in time. In addition, the PPEs, just to give you a simple, this one, in a week, we utilize almost 1 lakh PPEs. So that cost goes up. Then accommodating the crew in case on a layover, the accommodation costs go up 19, 17 days they cannot be utilized. So in many areas, the operating costs go up and the revenue is just not coming in at this point of time.
Right. So yeah, a lot of questions pouring in, and one question: can I carry my own disinfectant with me? I think Nageshwar Rao sir has addressed that. I think it's 100 ml. The limit is.
Yes, 100 ml bottles can be carried, but my request is don't use it on the aircraft parts, because to clean the seat, they are rest assured they are all cleaned. But within the aircraft, for cleaning the aircraft parts, you need approval from the manufacturer. So only not all the sanitizers are approved for cleaning on the aircraft parts.
Yes.
What you can carry is your hand sanitizers. Frequently keep sanitizing your hands, and that will help you.
Perfect. I think we'll take a couple of more questions, 2-3 minutes more. Next question, I think it fits for Shukla sir really well. Does maintenance personnel should take more care while replacement of HEPA filters during this pandemic? And if yes, how? By Praktin. Yeah.
Yes. So it is very important because the filter is doing filtration work. So of course on the surface will have some microbes and virus and other things. So the utmost care need to be taken while replacement of the filter. As per manufacturer guidelines, AMM guidelines, you need to follow precaution. You need to wear the kits. We need to take care of your hand, gloves, face, everything. So there is standard guideline given by the manufacturer in the AMM. Aircraft maintenance manual has given all the standard precautions need to be followed, and over and above that you need to follow the guidelines given by your company on your procedure manual, that what additional safety measure you need to take through medical department or your own company procedures. So combination of both is required while replacement of these filters.
Perfect, sir. So the next question goes in regards to cabin crews. So if cabin crew test results are negative, then how long this COVID report will be valid for? Question by Priyanshi. Yeah. Anyone? Yeah.
Generally,
5 days.
5 days is the general norm.
5 days, yeah.
5 days is the general norm.
Perfect. Thank you for that. And obviously, the next question is quite optimistic. So, sir, will the air traffic will increase in the near future? Yes.
Yes, definitely.
A lot depends on if we have been able to inculcate a sense of confidence in you. The airlines across the board, and I speak for all the airlines at this point of time, they are putting their best foot forward. The ministry and the DGCA are ensuring that every single protocol which is released by the ICAO, IATA or WHO is followed to the T. The industry is putting its best foot forward because this is a crisis which has come in and all of us are in this together. So it all depends on how the passenger now takes on. One of the things we are hoping that if the quarantine, people do want to travel, but the quarantine rules are a little bit of a deterrent. With the new unlock guidelines released day before yesterday, I hope this will also get addressed and we will also see air traffic increasing.
Right. And I totally relay your answer to what our Civil Aviation Minister Harpreet Singh Puri said. He's quite optimistic that as the sort of festive season comes, the numbers are expected to bounce back in a much bigger way. So yes, let's have an optimistic point of view. Right. So the next question is in regards with the airports. So what airports should do to build confidence to the passengers while traveling? So from the airport side, what can they do? Yes, anyone? Shailesh sir, why not?
No, airports themselves have to really take care of congregation of the passengers. So that exactly where the problem will start, because the aircraft is safe and the airport has to be kept safe. So not to avoid congregation of passengers, social distancing.
No. Get up.
Yes, perfect. And I think we are running sort of short of time. So with that, I would like to conclude the Q&A session. Thank you to all the panelists for answering the queries. Although we are sort of running out of time, we have managed to cover actually majority of the theme today, right from technical to in-flight safety to passenger health and well-being. Before we move on to the final phase of our today's session, I would request all the participants to kindly fill in the feedback form, which is available in the chat box, and let us know your valuable feedback on this particular session. I would like to thank President Kala Sridhar for giving the stage to share our voice. I would also like to thank the behind-the-scene heroes of Team Udaan Aviation Academy, Nikhil, Tanmay, and Jay, for your valuable contribution. I would now hand it over to President-elect Ashish Patankar to deliver the vote of thanks. Over to you, Ashish, sir.
Good afternoon, everybody. We wish to thank our chief guest, PDG Praful Sharma, our DG Sunnil Mehra, College of Governors, especially PDG Lata Subraidu, the district court team, our esteemed speakers and panelists, Ms. Harpreet Singh, Mr. Shailesh Deshmukh, Mr. Vinod Shukla, Dr. Punita Masrani, Colonel Dr. Nageshwar Rao, Rotarian Manmohan Chawla, Mr. Subhashis Modak. We also wish to thank our co-host clubs, Rotary Club of Mumbai BKC, Chandivli, Mulund, North Island, Cosmopolitan Ahmedabad, Daisar, Ghatkopar, Harmony, Jewels, Juhu Beach, Kalakar, Kandivli, Mahakali Heights, Padleshwar Royals, Sea Coast, Bombay Uptown, Rotary Club of Vasai, Rotary Club of Virar, Rotary Club of Mumbai West End, Worli. We also wish to thank our members of Rotary Club of Mumbai Juhu, the Udaan Aviation Academy, Aeronautical Society of India, Mumbai branch, all our invited guests, all our Rotarians. This has been a fantastic session, and I'm sure any average air traveler would have been addressed his concerns in the safety of his flight to wherever he wishes to travel in this COVID times. Thank you very much.
Thank you.
Thank you.
Thank you to all the panelists. Thank you.
Okay, let's close down.
Thank you, everyone.
Thank you, everyone.
Thank you, everyone.
Yeah.
With this, we conclude
Thank
this
you,
meeting.
everyone.
Thank you very much.
Thank you.
Can we all sort of turn our videos on for a final photograph? Sorry, quickly.
Okay,
Yeah.
okay.
Yes, perfect. Thank you all. Thank you.
Thank you. Bye-bye.
Have a nice day.
Bye-bye.
Bye, safe. Be
Bye,
safe.
madam.
Thank you. Hope to see you on board soon.
Yes, sure.
Thank
Bye-bye.
you. Thank you. Thank you.
Thank you. Thank you.
Thank you.